a degree is, all of a sudden, you lose your humility. And you feel that you have the power. Instead of enacting change, you are out to self-serve. And I think that I've learned more from community organizers and people like Anthony Feliciano. Please raise your hand, Anthony. Than I've learned from anyone with any degree behind their name. Just a little bit about myself. I grew up in Richmond Hill, Queens, in a community that often was targeted or ignored or neglected. And I often say that advocacy means different things to different people. For me, advocacy in a community where you're often stifled is speaking loud enough for even one person to hear you. And as you really gain courage and you realize that so many people have great intentions coming into the community, communities of color, underserved communities, wanting to do something, but so often the community voice itself is lost. And I really wanted to make my life about promoting the voices that are unheard, that are neglected, that are targeted for the wrong reasons. I soon found myself in medicine, and there are preclinical years and then there are clinical years. So in my first clinical year, which was third year of medicine, I really saw injustice everywhere. And so often we think about segregation, we think of Brown versus Board of Ed, but there's nowhere else that segregation is so strong and powerful than in healthcare itself. And so in this city that we live in, so often uninsured or underinsured patients with public insurance make their way to safety net hospitals, public hospitals that have great doctors like Dr. Hurley, who is a mentor of mine, but also they're low resourced. And then so often patients with private insurance end up at places like Mount Sinai, like NYU, like Montefiore. And there's these segregated pathways that happen over and over and over. And then if a black and brown patient, if a poor patient makes their way to places like Mount Sinai or NYU or a private fancy specialty hospital, so often there are more segregated pathways where the patients end up in different clinics, where they're public clinics that are served by people like myself, trainees, medical students, residents. And then patients with private insurance are served by doctors who are faculty members and attendings. There's no continuity of care in the public clinics, but there's continuity of care. There's great access to specialty services in the private clinics. How could we think that separate is equal?
That's right.
We can't. And so many people go through this system, so many doctors go through this system, and you think they don't feel it in their heart that something is wrong. But we have to use the privileged voices that we have to sound the alarm when something is wrong. And that's what I wanted to do, because every time we see injustice and turn away, we're actually losing part of our soul.
Say so.
And I chose not to do this, and there's so many amazing people who are doing this day in and day out. Community organizers all over New York City, doctors who work at the public hospital. When we were starting this coalition, I'll tell you a personal story. I met Dr. Matthew Hurley, who's being honored tonight. And he is the most humble servant of communities that I've ever met. I sat with him for 15 minutes. And in those 15 minutes, he taught me more than I could ever learn from any textbook. He said to me, sometimes calm, he learned that people call me calm. And he said, sometimes calm, we have to know that we have to listen. And sometimes we have to speak. So knowing when to listen and when to speak is very important. He attended our coalition meetings, and he would be the most brilliant person in the room, yet the entire meeting would go on, and he wouldn't say a word. Then someone else would say, actually, Dr. Hurley did some work in this area, and then he would spit out tons of information that no one else knew. He was definitely a servant of all of the communities he worked with, and so is the entire Doctors Council organization. And I admired him. Please give him a round of applause. So the point of our coalition really is to work to undo racism. And that sounds like a task that will never happen. To so many people, they think many things are idealistic. For instance, so many people think access to healthcare, universal healthcare, is idealistic. When Bernie Sanders said that over and over, everyone said, this man is a lunatic, that's idealistic. But to me, basic healthcare for everyone, basic rights to food and housing is not idealistic, it's realistic. But it's only realistic if each one of us believes that we shouldn't be out to capitalize on others to make a name for ourselves. You see, a lot of people think of baseline, and then they think of the disadvantage. When they think of racism, they think of, so the people we're oppressing, and then normal. But every time there's disadvantage, there's an advantage group of people. Every time there are people that are suffering, there are people that are capitalizing on the people that are suffering. So let's recognize white privilege, class privilege. Let's recognize all of the forms of oppression, sexism, homophobia, all of these things that Trump ran his entire campaign on. You see, a lot of times people think that Trump ran despite of racism, but the fact of the matter is that he ran because of racism. And we have to realize that racism is deep-rooted in this country, and it takes every single one of us to undo it. So the last thing I'll say is that anger and sorrow can be paralyzing. And Trump's victory, and I don't hesitate to call his name, added to hundreds of years of injustice, just becomes too much to think about, to fight against, to undo. I also know that you are strong, we are strong, and our energy feeds off of each other. So let's please be there for one another. Let's reach out to all those we know who are suffering at this time, and there are many, many people who are fearful, who feel unwelcome when walking the streets of this nation. And let's realize that nothing truly is too idealistic to be accomplished. So with all of this said, please support our coalition. I see some more members of our coalition who are in the back there. There's so many people in our coalition who are so humble that they always take the back seat. And I think that humility is the only way we can learn from each other. So let's continue to grow. Let's continue to work together. And I should never, ever, ever be honored